Hey everybody, it's Dr. Paul Thomas with Startup DPC, and today I have a very special guest. His name is Dr. Timothy Wong. He's with iHealth in Pittsburgh, Pennsylvania, and he started this really unique clinic. You know, direct primary care is unique enough, but he's really doing direct care and charging people $35 a visit. And so we're going to talk today about that. Dr. Wong, thank you so much for coming on the show.
Sure, thanks for having me.
So, you got a lot of press. You got a ton of buzz around your clinic, specifically from NPR. That article was shared thousands of times on Facebook alone. And so a lot of people found out about your practice. Can you walk people through who haven't seen that article, talk about it for a few minutes? Yeah.
Yeah, so I think the model, I'm sure I'm not the only one who's done it or has done it or is doing it, but I call it direct access primary care. And so it's a little like direct primary care where we don't work with insurances, but so that keeps us efficient. You have the advantages like direct primary care where you can concentrate on the patients. But I also merged that with a micro practice model. So I am the only staff member, and that way I can keep the costs low. And so pretty much I'm able to keep a price point of about $35 per visit. If patients come in with more problems, I do charge them extra. Kind of like the free market. So if you go to a sandwich shop, you buy one sandwich, it's a set price. But if you buy two, it's a little more. So it's kind of like that. And we don't have membership model. We don't have actually even a schedule. That's why I promote it as direct access. You really just have to come in. The only thing we don't really do is, since I'm the only one, is kind of gyne exams, pap smears, since I don't have a chaperone, and we don't prescribe narcotics routinely, but that's a personal choice.
Yeah, that's awesome. I think that's a really good summary of what you do and how you've been operating. The big question a lot of doctors are going to have is, are you successful in this model? What's your volume like every day? How many patients are you typically seeing each day? And are you happy doing this, or is this? So let's start with a volume question. How many patients are you seeing a day?
Yeah, so I actually like volume. I also like having to pay per visit because it keeps me hungry in some ways, because I don't feel like, oh, there's a patient here and I get a fixed cost or fixed pay. Now I have to do extra work. So I kind of like that motivation to, hey, there's a patient in, that means I get a little bit more money. Our volume before, the pandemic was at least 15 patients, and it went as high as 32.
Oh, wow.
And so there is some variation. We do cater to a lot of acute urgent care issues. So it's just demand for acute urgent care convenience is way higher than kind of chronic primary care.
Yeah, that's really interesting. So 15 to 32 patients a day. So you're bringing in anywhere from, let's say, $600 to $1,200 a day, and taking care of a pretty low overhead because you don't have any staff. So, when you think of it in those terms, it's pretty good. For the viewers at home, it's March 27th when we're filming this today. So the coronavirus has really slowed things down. Have you pivoted at all to virtual care, or are you still billing for in-person visits only?
So I haven't pivoted, but I would say we've been actually pivoting since last year. Before I even opened the physical location, I've been creating a platform, my own platform, with some developers. It just got actually submitted to the Google Play Store this week. So fingers crossed. It's taken a lot longer than I wanted it to. Debugging is not fun.
Well, that's awesome. What's the platform called, and what's the gist of it?
It's called iHealth Teleclinic. It is kind of like a lot of other platforms where you get that video, secure HIPAA compliant video, but we also have a twist in that you can do a text visit as well. So you can have a video scheduled appointment or a text visit that has to be done within 24 hours, but it's neat because it can be asynchronous. So if you have downtime as the provider, that we're either doing paperwork or just resting. But now I actually have this increased revenue stream of, if I'm not seeing patients, I can text back and kind of further along that appointment. The other unique thing
That's awesome.
that's, there's no way of patenting it. And it's, once the app is released, everyone will know what we do. But actually, before patients even schedule the appointment, they're filling out an HPI. So there's conditional logic behind that. So that, say, if you say you have hypertension and that's why you're doing your telemedicine visit, it's not going to ask you silly questions like, what is the location of your hypertension? Or what is the quality of your hypertension? That doesn't really make sense. So it asks pertinent questions like, are you taking your medications? Are you having any chest pressure, shortness of breath, head pressure, headache, all those things.
Awesome. So I think that's all really wonderful. And I think that's a big part of this movement, this direct care movement, is physicians leaning into entrepreneurialism and taking control of their revenue streams and how they care for their patients. And I think that's something that doctors don't really think about. It's like,
oh, no, not at all.
If you create a really good business model, you can treat patients really well, take care of them to the best of your abilities, and earn revenue at the same time. So, I think that's something that kind of gets lost in the sauce when somebody signs a contract with a big hospital system.
Yeah, I kind of, one way I thought of kind of the issue is that when we're doctors or providers of some sort, we have a lot of masters. So, the patient is our master because we have a patient-oriented healthcare system now instead of a patriarchal healthcare system where, back 30 or 40 years ago, whatever the doctor said was the law. And patients, either you did it or you die, whatever.
Yeah, or like paternalistic approach to healthcare.
Exactly. But we don't have that. So patients are the master. We also have a master of ourselves. Like, we owe it to ourselves to be healthy, to not burn out, to make sure, we are bringing a paycheck so that we can feed our family or ourselves. But when you work with insurance, you also have insurance as a master. And that is a very difficult master to do. Like, and it's getting worse. Every year there's increased quality metrics, there's increased things, and some of these quality metrics make no sense whatsoever. I love the CMS quality metric now that for Medicare patients, they grade you on the blood pressure of the Medicare patient in the clinic. So they can have recorded blood pressures that are perfect. They just have white coat hypertension, and you're forced to pretty much sit them in a room for 15 minutes, even after you've left, and have an MA just check their blood pressures again and again and again, just to get a quality metric. That makes no sense. Like, it's bonkers. So you have insurance companies as your master, and sometimes you can have a boss, like, if you work for a hospital system, your practice manager is partly the boss. So, when you work for a healthcare system, you have pretty much 5 bosses. But if you work for yourself, you really have 3. So it's a lot better. Actually, I think it's 2.
Yeah, the 2 being yourself and your patient, right?
Yes.
And, sometimes when maybe later when you become an employer, if this thing grows for you, you're also going to have the people who you take care of as your employees as part of that responsibility. Mm-hmm. So let's pivot a little bit. So would you say that you're successful in this clinic? Would you recommend other doctors who are, like, let's say, coming out of medical school, would you say, oh, you should definitely go to family medicine so you can start a direct access clinic? Or would you recommend residents to start a direct access clinic as well when they come out?
So success is built on a lot of, metrics. So if you're looking at volumes, we've seen about 1,800, maybe 1,850 patients in about 8 months.
Oh, wow.
So
it's amazing.
That's pretty good. And we're increasing, we're accelerating. So, it's going to grow. Those are unique patients, not just encounters or visits. Since we've been open, now we're seeing, I'm seeing kind of repeat patients, which is nice because family medicine trained, I really like that longitudinal chronic relationship. So that's nice. In terms of financial success, I think we're financially feasible. We specifically took no grants, no volunteers, no outside funding to show that you can do this. It's scalable, it's reproducible, whether you're in Iowa, whether you're in Hawaii, whether you're in, Washington State, you can do this. You might need some starting capital, you might need some business loan, but however you want that initial capital, you can do it. The trick to the model is really just low cost, and everything else besides the cost is your salary. So it's not bad.
Yeah, that's great. I think in terms of startup capital, it's important to know that you can get a loan as a doctor. It might be $30,000 or $50,000 or $100,000, and that could be enough to launch something, especially if you have a low overhead business like yourself.
Yeah, and since I really have one exam room, since I'm the only person, it's, even equipment costs were not that high.
Sure.
I think the most I spent was just on advertising, and, being a new company or a new clinic, you never know where to put your money when you're advertising, and you can never it's really hard to gauge if it's working. So I think that's the biggest kind of pit, is just marketing when you're completely new.
Sure. Let's dive in on that. As a physician, as physicians, we're not trained on how to engage with the media or how to work with the media. And personally, I have a personal mission of helping other doctors succeed in their direct care practices. And one huge piece of that is branding, personal branding, business branding, and marketing, and media relationships, like public relations sort of things. So can you talk about how you engaged with NPR? Did they find you? Did you seek out them? What was that relationship like? What was that process like?
From what I've gathered over the last about 8 months is that media kind of snowballs. So once you get one thing, a lot of reporters actually are looking for stories. We don't realize that, but they're actually looking for stories. And if you have an interesting story, they're going to reach out to you. But you have to get that initial momentum going. So how I did it was, I had started from 0 patients. I was just sitting here for 11 hours a day, just hoping someone would come in. So I had a lot of free time, and I would just kind of cold call. It wasn't cold calling. It was just cold emailing, local news places, and be like, hey, I'm starting this new clinic. That's not normally new, but this model is pretty new, and I think it could have a lot of social value. And so it started with a local newspaper, and then it grew to NPR, and then we had national coverage with a TV show, and then we had local TV. We had actually Al Jazeera Plus was here for 2 days to do this mini documentary.
Dude, that's amazing.
Yeah, it was pretty crazy. I think I don't know if it was true, but some guy called me from the Doctors TV show. But then
nice.
He never emailed me, so I don't know if it was I don't know, who knows. But so it just snowballs, and as long as you have an interesting story that could, I think, touch a lot of people and help a lot of people, I think it kind of speaks for itself.
Yeah, I think a lot of doctors who are doing direct care or a direct care type model are in that same boat where it is an interesting story. In journalist parlance, they say, this is the peg. What's your peg? What's the interesting thing here? And for you, your peg was, number one, we're launching a new practice. So new business. A lot of small towns, small media markets will just cover any new business that opens, but you're in a slightly larger media market in Pittsburgh. So that extra thing that makes you special is that this is only $35 to see a doctor, and he's doing well with it. So I think takeaway for people watching is just you can take these shots and email these journalists because they are looking for that next story.
Yeah, and you can do press releases. You can just email, every news place has a submit a story kind of thing.
Sure.
You could start with that, and then the good thing is there's nothing to lose. If they just don't reply to you or you never hear from them, you haven't lost anything. You lost 15 minutes of writing an email to them.
Sure. Yeah, exactly. And, I've been around for 4 years almost now. And man, I've sent out hundreds of emails and we've had maybe 10 or 20 people cover us. So it's like maybe 1% or 2% of those emails you send out are actually going to work. But that can be the difference between a really profitable business and a mediocre business. So you have to take those shots. You have to take those chances.
Yep. Yeah. And like you said, trying to have a unique story helps too. Yep.
Awesome. So let's talk about a little bit of the business dynamics. What kind of EMR are you using in your practice, or how are you keeping track of these patients?
So I use Athena Health, which is really great. I think it's one of the best EMRs. I've used Greenway, I've used Cerner, I've used Epic. Athena Health is actually really nice for startups because they take a flat fee out of your revenue. So you don't get hit with a huge monthly fee and just take, you're constantly in the red even when you start. So they scale with you. So it's perfect really for startups.
That's awesome. So they're taking a percentage of your revenue essentially. Nice.
Yeah. So like mine is like 6-something%. And it might seem high, but that also includes all merchant fees for credit cards. So they process all the merchant fees.
That's awesome.
So that's 2 to 3% right there. So really, I'm pretty much paying like 5% minus the merchant fees because some patients pay just cash outright.
Nice. That's awesome. And then, are you using any HIPAA compliant software to talk with your patients? Is that included in Athena, or in our practice, we have our patients waive my obligation, their HIPAA rights, so I can text and email them without any consequences, as long as we keep it, relevant to their healthcare.
Yeah, so it's always tricky. I do part of the consent is to say, hey, it's okay to text you. I try not to text, patient data, more like, oh, your refill was sent, and I don't say the med, I don't say, any details.
Sure.
Or I say like, hey, your test results in, give us a call, but I don't say any specifics. But what I actually use is, because I'm a micro practice, I have a self-check-in system that I kind of designed. It's pretty efficient. Like most patients who've ever used a tablet and an iPad can do it. And so it uses Google Forms, which is HIPAA compliant if you get their business kind of program. They all sign a BAA with you. And then the Google Forms goes into a Google Sheets, and I just copy and paste the demographic and the past medical history data into Athena Health. And I can actually prep a chart in like 1 minute.
Oh, that's awesome.
How I can stay super efficient.
That's awesome, man. Yeah, we use Google Forms actually for it's de-identified like Beck's inventory and Hamilton's for depression and anxiety screenings and things like that. It's a fantastic tool that doctors don't even think about. So I'm glad you mentioned that.
And it's cheap. It's like, I think I pay $11 a month, and it's like one of the backbones of how this clinic works.
Awesome. So I got a couple more questions for you. What's your trajectory on this? Do you want to be a solo doc seeing 15 to 30 patients a day for the long term, or are you looking at expanding and growing this, or are you going to pivot into more app-based care? What's the future hold for you?
So I've thought about kind of the 5-10 year goals. One thing is I want the clinic to grow. I'd like to see more 20 to 30 patients a day. So there's definitely room to expand. I like the volume. And since it's mostly urgent care, it's pretty quick. And so I can get through visits in about less than 15 minutes, even doing the chart and getting their payment. In terms of long-term goals, my goal is actually to promote the direct access primary care model. Yeah, so I really think, kind of what you alluded to before, is it working for me? Yeah, less burnout. I enjoy it more. Right now, it kind of sucks because I'm seeing like 5 or 6 patients a day. That's not fun, but I think the model would definitely work, and patients love it. Especially those without insurance or with high out-of-pocket costs and have commercial insurance. they pretty much, this is really the best financial choice for them. So I think the model will work. So I really want to promote that. And trying to promote that would be there's so many different ways to do that. Like you can provide support, you can franchise, you can, just do a consulting kind of thing, or you could just make it kind of like completely open source and tell everyone exactly line for line what I do and say, hey, that's out there now. So that I'm trying to figure out what to do. I'm also working with some developers to create this platform that does the self-check-in, the telemedicine, and other features all in one system. Because right now I use Google Forms, I use HIPAA, and our telemedicine platform is different. So trying to create all in one. And that way you can kind of use that as a tool to get other providers into direct access primary care by offering kind of this plug and play solution.
Awesome, man. Well, I think we're going to end it here. I really appreciate your time, Dr. Wong. It's an amazing model that you have. Not only sounds like it's working out well for you, but like you said, it's really an option for patients in your community to get excellent primary care services at a really affordable cost. So I really commend you for what you're doing. And again, I thank you for your time.
Sure. Thank you. And take care.
All right. You're welcome, man. Talk to you later.